Hello, I'm Divya and I'm a mental health and wellness coach currently into sports psychology. And here we have a guest today for our interview and a little discussion on mental health and well-being. Hello, sir.
Hi Divya. Such a pleasure to see you here.
Yeah, it is nice meeting you after so long because you have always been an inspiration in my career. So, thank you for that. How do you define the concept of holistic well being, particularly in the concept of mental health and healthy lifestyle?
All right. So when we talk about holistic well-being, a lot of people say that I have this goal. I want to be this and that. Their goals are pretty singular, which means that they either want to earn money or they want to have a physical health goal, or you're into sports psychology, so they want to excel in a specific sport. However, when we talk about holistic well-being, it typically means that you have a good balance of all these five major areas of life. One, mental health, like your mood, your behavior, your functioning, overall functioning. This is mental health. Second would be your physical health, how well physically fit you are, including the diseases that you might have. The third is interpersonal well-being, which is how good and fulfilling your relationships are. They could be romantic or non-romantic relationships. Fourth would be academic and professional well-being, where how well you're functioning in terms of, if it's academics, then how well you're scoring marks, and then it's profession, how stable you are in your profession. And the last one is financial health. So I think the next best thing to achieving any of these, one, is a balance between all of these. So this is my concept of holistic well-being.
Yeah, that is really nice because you have mentioned different aspect and different domains, and really it is really important, and I think people should get it. So thank you for your answer. What's your opinion on interconnection between mental health and lifestyle choices?
Big time connection. In fact, it's a two-way connection. Your mental health affects your lifestyle, and your lifestyle affects or influences your mental health. So I'll give you a very simple example. If my mental health is bad, say for instance I'm in a bad mood most of the times, so my lifestyle choices would be different. For example, I would scroll on the internet till late night just to feel good about, just feel good. I might want to eat unhealthy food, which is not good for me. I might want to shop a lot because that just makes me feel good. So I might also choose unhealthy lifestyles like not going to the gym or avoiding socializing and skipping work, or any of these lifestyle changes because my mental health is bad. Now, with these bad choices, I will either worsen my practical problems. Say, for instance, if I'm not going to work, I might get fired from my work, which will in turn influence my mental health. Because of my bad choices, such as alcohol or tobacco or smoking or unhealthy eating, this will create an additional practical problem. So my existing practical problems will worsen, and new practical problems can be created, which in turn influence my mental health. So you see that there is a loop, a two-way connection between mental health and your lifestyle choices, and they both influence each other.
So promoting mental health awareness, still there is not a lot of awareness around. So can you recommend some strategies which we can do to aware mental health in our society?
So, people have a very vague idea about what mental health domain includes. It not only includes your mood and, just disorders such as depression or anxiety, but it also includes anything that you act. For example, going to the gym is a mental health issue. Procrastinating work is a mental health issue. Having alcohol is a mental health issue. And scrolling on your phone till late night is a mental health issue. So anything that has to do with the way you behave, anything that has to do with the way you feel and your choices is included in mental health. It's not just disorders or mental problems, as people call it, but I would say anything that has to do with your mood and behavior can be included in mental health.
So, can you suggest any practical tips which people can incorporate in their daily lives to keep their mental wellness good in a good state?
Excellent. So, we call this as mental health hygiene tips, right? Now, there are some non-negotiables when it comes to mental health. There are three non-negotiables, and I'll tell you about two more, which will enhance people's mental health, whether they have a disorder or whether they don't have a disorder. Number one non-negotiable is sleep. You have to sleep. If you are an adult especially, you have to sleep between 10 to 6. Now this timing is very important, and the duration is also important. So we are looking at 8 hours of healthy sleep pattern from 10 to 6. Another non-negotiable is eating. You have to eat well. I won't give a broad lecture on nutrition, but just remember that every bite you eat should be nutritious, right? Do not skip meals. Do not overeat. Do not do do not eat anything that has not been advised by your nutritionist or your medical doctor, right? So eat healthy. And the third non-negotiable is exercise. Everyone, whether they are old or they are young, must exercise for reasonable times. Like, what is important is to exercise for 1 hour a day. It does not matter what intensity. It will depend on you. How strong you are, how old you are, but based on your physical health, you must exercise something for at least 1 hour a day. Now these three are non-negotiables, and there are a few more tips for maintaining your mental health or enhancing your mental health. The fourth point I keep telling people is to reduce your screen time. So the lesser the screen time, the better. The recommended screen time by scientists for people is 0. They do not recommend screen time. However, recreational screen time should be less than 2 hours, because we already have a lot of screen time when it comes to work. So keep your screen time as low as possible. Another thing that will help you enhance your mental health would be socialize more. So the more fulfilling relationships you have, the better mental health and physical health also. I mean, like, there is a study by Harvard University that was an 80-year long study done, and they said they found out that the major factor contributing to mental health is fulfilling relationships. So if you have fulfilling relationships, whether romantic or non-romantic, you're gonna have better mental health, right? And the last one is define and create purposes of life. Whatever you do, align it with your purposes of life. And how do we create purposes of life? Purposes of life are not found. You have to create them. So they should be created based on your value system. So if you have a current value system of like 1, 2, 3, 4, 5 things you value, define, create some purposes of life and do something in that direction every day, right? So these are some tips for enhancing your mental health and also laying a foundation to good mental health.
Thank you so much. It was really a good answer, because the way you mentioned it, hygiene tips, it is really important to use such words, because it gives you that thing like, yeah, I will do that, because it's a hygiene tip, right? And also you said that create it, because no one is gonna create it, so you have to do that. So that's really helpful. So going on to stress, nowadays people are like using it frequently. I'm stressed, I'm doing this, I have a lot of stress. They are using it so frequent in their day-to-day lives. So do you suggest any normal techniques they can use daily in their life?
I have heard a lot of words that professionals use include trauma, OCD, narcy, and so on, right? So in a way, it's a good thing that people are using these terms, but they are not accurate to use. So when we talk about stress, stress is a reaction of you towards the environment, right? And believe me, if there was no stress, we would die.
Exactly.
Imagine, like, I am thirsty, and my body tells me that your water level has gone down, and I feel stress. If I did not experience stress, I would not take action to drink water, and eventually I would die. If I did not have the stress of hunger, then I would probably starve myself and then die. So stress in itself is not bad. It is when it becomes distress, then it is something that needs to be done about it, right? So always tell yourself that stress in itself is not bad or unhealthy. However, distress can be. So if you're distressed about something, say for instance some external events, and you have been distressed for a longer period of time, or it is very distressing, then something needs to be done about it. Then another factor to identify is to look at, is the distress affecting your body in some way? For example, are you losing appetite? Are you losing sleep? Are you having symptoms such as palpitations? or sweating, or probably shaking legs, or anything physiological reactions that are prolonged, right, and sufficiently interfering with your work. So if, let us say that I'm distressed about the death of my pet, right, and it affects my work for more than a month, right, then I think it needs to be addressed, right. So number one, distress, is it affecting your work? Distress, is it affecting your body functioning? And distress, is it affecting your relationships? So the dysfunction of it and the pain of it, the degree of pain, these are some parameters that we need to understand, that the distress needs to be addressed and something needs to be done about it. But all of us experience distress as well and stress as well, but not all distress needs attention.
Yeah, exactly. Thank you for mentioning it, because I think after looking this interview, people will get to know what actually they need to look after. Also, it is said that prevention is better than cure. So also it applies in mental health. Do you think how can we prevent mental health rather than going into a very difficult stage or very critical stage in it?
Divya, look at the causes of mental health issues. If we look at the causes of disorders as such, right, they have complex causes. We cannot put a finger on one specific thing. And a lot of these factors are biological. So if we look at how mental health issues develop, you will see that there is a genetic predisposition to mental health disorders. And there are issues such as vitamin B level, vitamin D level, your thyroid levels, your hemoglobin levels, your sugar. Now these and other hormones such as the male hormones, female hormones, everything. Now slight changes, very slight changes in these body chemicals influence the mental health greatly. So the first thing we look at while preventing mental health issues is, of course, yet we cannot do anything about the genetic factors. Like you are born with certain genetic predispositions, but you need to take care of the body chemistry really, really well. And if you keep check on those levels, like specifically the vitamin levels and the thyroid levels that I mentioned, if you keep a check on it, you will be able to prevent a lot of mental health issues. The second thing I would want you to focus on is the mental health hygiene. The more you follow mental health hygiene, the less problematic it will have. And the third tip I would give is do not trust all negative thoughts. Just because you think something does not necessarily mean it's true. So keep a watch on your thoughts. Not all thoughts are true. If you trust all your negative thoughts, and if you respond to every single negative thought, you'll probably have a bad mood.
Yeah, I totally get it, because I too experience it, and it's really difficult to differentiate, and you should be very insightful about it, right? So people don't have knowledge, I think, so that may be a problem for them. But yeah, thank you so much. So talking about long-term vision in this mental health advocacy, how can society work towards it?
Society needs to, first of all, acknowledge that everyone can benefit with mental health professionals, and nobody needs a therapist, right? So, everyone can benefit with a dentist, everyone can benefit with a physiotherapist, everyone can benefit with a medical doctor. So similarly, everyone can benefit with mental health professionals. So the first thing is to shift your perspective from who needs it to who can benefit from it. The moment we do this, we will be doing more visits to mental health professionals for the prevention aspect of it, for the development aspect of it. For instance, you're a sports psychologist, so let's say that I want to enhance my performance in a specific sport. A mental health professional can help you enhance that, right? Similarly, so other one would be, I'm distressed about, let's say, something has happened in my relationships or my work, and I'm distressed about it. So mental health professionals can reduce that distress. And the last one is to understand that mental health professionals also treat disorders. But just because you're going to a mental health professional does not mean you have a disorder. And even if you have a disorder, it's not your fault, but it's your responsibility to take care of the disorder.
Yeah, exactly. Because I also think that people still have the wrong knowledge about it. That it's not for someone specific, but everyone can go and take advantage, or it's beneficial for even small things like my procrastination going to gym. So I will also need a therapist just for counseling and just taking good things from them.
I will correct you there. You don't need a therapist, but you will
Oh,
benefit from a
sorry. Yeah,
therapist.
exactly. Benefit from a therapist. Okay, this is all professional things. Going on to your personal journey, because you were a homeopathic doctor and then you are now a great psychotherapist, well known psychotherapist. So, how you came into this thing and this career? What inspired you helping, or what inspired you to go into mental health after homeopathic?
What inspired me was distress. So when I started practicing as a homeopath, my mother is also a homeopath. So I found that the homeopaths put a lot of emphasis on mental symptoms and the mental health domain, right? However, they lack the training of how to elicit mental health issues or mental health symptoms or mental symptoms. So I looked into BA psychology and then I did my MSc psychology, and I found nothing, no practical training in how to ask questions. So that you know created more and more distress in me. That no, I have to get to the root of it. So then I sought training in India, again dissatisfied. So then I went abroad. I went to Albert Ellis Institute, New York, where I suddenly realized that there is a part of world that's 25 years ahead of where we are, and then so much has been done in mental health, and how to counsel people, how to train others in mental health issues. So I quickly got all the training. Like in 3 years time I became a supervisor and a trainer myself, and the journey still goes on.
Yeah, that's really important, because I just went to UK after before a year, and yeah, it's totally different. The difference from India to there is like, oh, I have to learn a lot of things because I don't know anything which is in a practical world. So I think that's really important. But I will definitely say that you are the best trainer in CBT and REBT.
Thank you so much.
And it's not just my point, but a lot of people have said this to me, because the way you teach, you have just changed it into an Indian way, we can say, and it's really helpful. So thank you so much for doing that, and thank you so much for inspiring individuals to go into this.
Okay.
Thank you so much. Thank you for your time.
Absolutely, it is a pleasure, and I'm really proud of you, Divya. You've done great work, and I wish you all the best in this field, sports psychology, which is extremely needed today.
Two things we discussed today were, first, mental health hygiene, and second, the balance between all areas of life. And stay tuned for more such interviews. Thank you.